This is the Eat Well, Think Well, Live Well podcast. I'm Lisa Salisbury, and this is episode 155, Mindset Plus Medications and Surgery for Weight Loss with Dr. Pavi Kundhal. My guest today is Dr. Pavi Kundhal. He is a general and laparoscopic surgeon who specializes in minimally invasive surgeries like keyhole surgery. He is a diplomat of the American Board of Obesity Medicine, which is a designation showing his expertise in obesity medicine. This is a prestigious designation that very few surgeons in Canada hold. He has been a member of the Department of Surgery at William Osler Health System since 2012 and is the site chief of general surgery at Brampton Civic Hospital. He is an assistant professor of surgery at Toronto Metropolitan University. Dr. Kundhal also has a clinical interest in surgical and non-surgical weight loss and has completed numerous postgraduate courses in this area. Today, we discuss Dr. Kundhal's belief that one's mindset plays a critical role in health and healthy weight maintenance. We dive into mindset shift techniques such as mindfulness, affirmation, gratitude, meditation, and self-reflection through journaling that play a key role in changing your relationship with food. It's an honor to have such an expert as Dr. Kundhal here with me today, so please enjoy this episode. Welcome to Eat Well, Think Well, Live Well, the podcast for busy women who want to lose weight without constantly counting, tracking, or stressing over every bite. I'm Lisa Salisbury, a certified health, weight loss, and life coach, and most importantly, a recovered chronic dieter. Here, you'll learn to listen to your body and uncover the reasons you're reaching for food when you're not truly hungry, freeing you to focus on a healthier, more fulfilling approach to eating. Welcome back to the Eat Well, Think Well, Live Well podcast. I'm so excited to have Dr. Pavi Kundhal here. He is a board-certified obesity medicine surgeon, and I think there's some other titles in there as well. I'm going to let him introduce himself. I'm just so excited to speak with you today about some of the weight loss solutions that you offer and get a different perspective. So welcome, Dr. Kundhal, and if you could just introduce yourself and give us some background.
Hi, Lisa. Thank you for inviting me on your podcast. It's a real pleasure. So my name is Dr. Pavi Kundhal. I'm a surgeon practicing in the Greater Toronto Area in Canada. I have a clinical interest in obesity medicine and I also perform bariatric surgery. I've been in practice for over 16 years. I performed thousands of surgical procedures and I've had thousands of patients come through my clinic and we've helped them with both surgical and non-surgical weight loss. I have 3 children, so it's quite busy. I have a 8-year-old, a 6-year-old, and 3-year-old.
No.
So I got my hands full both at work and at home, but I do enjoy it all. What I found through my clinical practice over the years is when I started, my focus mainly was on, obviously the technical aspects, the science, the guidelines. And what I found though over time was that there was often a high rate of weight regain, regardless of the different techniques we used. And over time, I started to see that despite our best efforts, there were things that were causing patients to go back to their unhealthy eating practices in the past. And that made me realize that we have to not just focus on the, quote unquote, the science, but also have to focus on, the individual, the person, what has kind of led them to, this point where they need to make changes and how to identify those factors. And one of the things that I found was that, in the beginning, sometimes, for example, after surgery, the surgery is, it's a very invasive thing and it can, compensate for a lot of things, but over time, you can develop strategies to almost, quote unquote, beat the surgery. And you need to try to understand what is causing people to kind of revert back to their previous eating patterns. And that's where I think the mindset comes in. It's very important to understand what often when people are, having eating patterns that are not good for them, it's not so much that it's that they're just making bad choices. It's all sometimes compensating for underlying reasons. And you need to sort of understand what they are. And that's where I think it's very important to introduce the concept of mindfulness in your life in general, but also the concept of mindful eating. And that's something that I tried to stress with my patients.
Yeah, definitely. It's like how my intro says, we try and figure out why we're eating when we're not hungry. And it's so much more important than what you're actually eating on some cases,
100%.
when you figure out what you're trying to solve for, when hunger is not the problem, that's when we really get down to like the root of the issue. So whether your patients choose a surgical route, a medication route, or a just a coaching sort of route like a lot of my clients do. And I've been kind of shying away from using the term losing weight naturally because I think people are pitting like those that use surgery or medication against those that do it naturally, and kind of putting the quote unquote natural way on a pedestal, which I don't agree with at all. I think there's a lot of ways to do it, but I'm just not sure what the right term is now. But anyway, without medication, I guess would be just the simplest. But in any case, everyone needs to figure out how we eat for the long term, because once you get down to your goal weight or natural weight, then we have to figure out, okay, how do I make this stick? One of the things that I try to do is help them to lose the weight the way they want to live their lives. So I have patients, not patients, you have patients, I have clients. I have clients that I ask, they're like, I just got to get off sugar. They tell me this, I just eat too much sugar. And I say, okay, well, do you want to never eat sugar again in your whole life? Or do you want to figure out how to eat sugar, how to have a sweet treat every once in a while without overdoing it? And almost without fail, they choose the second option, which means we have to have a way to eat a little something, what they call, a treat or sweet, while you're losing weight. And I think that is where the mindset comes in. So let's discuss some of those. That's just like one example, but some of the strategies that you use to introduce some of this mindful eating that you teach to your patients.
Yeah, that's a really good point. When you're trying to change your eating patterns, in some ways, it's one of the most challenging areas to work on because
Mm-hmm.
unlike, let's say, you're struggling with alcohol or you're struggling with drugs or gambling, you can go cold turkey on those things. You can say that
Sure.
I'm
Yeah.
not gonna drink again, I'm not gonna smoke, I'm not gonna whatever it may be. You can't stop eating. You have to eat to live. So that's
Yeah.
what makes this particularly challenging because you have to find that way to moderate. Like you said, it's not realistic to say that I'm never gonna have a treat again. And so I think what I do is I try to educate my patients about understanding the reasons why they're eating at any given moment. So really being present. So I think the first thing we teach them is the difference between physical hunger and emotional hunger. Those are two very different things. So
Mm-hmm.
physical hunger is when your body actually needs energy or needs calories to fuel its functions. So you may be feeling that feeling in your stomach, lightheaded. You haven't eaten in 6 hours. You can't concentrate. Those are signs that your body's signaling to your brain signaling to your body that actually need to eat. And now emotional hunger often just it can be triggered immediately. It's often caused by situations that I think people are aware of. So, I've entered a social gathering. I'm nervous. I'm not sure what to do. I'm not sure if anyone's going to talk to me. So you kind of head over to the food table, and it
Yeah.
just kind of seems like a natural thing to do. Or, I've gotten into an argument with someone, and I want to have that immediate feeling of, satisfaction. So it's often triggered by emotions, and those are different feelings. Now,
I
often what
noticed too.
happens, sorry, go ahead.
Do do you notice another trigger that I think is so common people don't, but they don't identify, is transitions. When you come home from work,
Yes,
when you go from working mom to mom at home, like when you change roles, it's very uncomfortable for our brain, and this is why we grab a snack to go get in the car, or why we go to the kitchen immediately upon entering our house. Or it can also be like when you get to work, you have to go to the break room first to like load up on the snacks, or you know what I mean? It's those
yes.
transition times that people don't realize, because it's not like supercharged, like walking into that social situation where you're like very nervous. It's just this weird like discomfort of switching roles. And I think that's an interesting emotion time as well to catch.
For sure. And I think also a lot of our eating habits are unconscious
Oh yeah.
and they're learned. So sometimes, we have distracted eating. So when you're distracted, you're not actually being present or mindful. So if you decide that I'm going to eat dinner in front of the TV, you're being distracted by
Hmm.
what's on the screen and you're not actually being present or mindful of how your body's reacting to your food. So sometimes you'll be watching a movie or a show, and when it ends, you have that feeling like, oh, I overate, and you didn't even realize it happened. And so these are kind of, and then you have that feeling, oh, I shouldn't have eaten as much. But it just was that you weren't being mindful, you weren't being present while you're eating. So that's one of the things we stress to our patients is you want to be an intentional eater. You want to be a conscious eater. You want to understand why you're eating at this moment in time. So for example, we tell people, if they're going to go for a meal, the first question we ask is ask yourself, am I really hungry?
Hmm.
And just putting that simple question and waiting 10 to 15 seconds sometimes can stop you when you realize I'm actually not hungry right now. Maybe I don't need to eat or I don't need that snack. So just kind of, so like you talked about the transitions where you kind of just had this unconscious behavior, you just kind of do it. It's sort of being present, trying to really understand why you're doing what you're doing. And just by, almost having that circuit breaker, it can stop those practices that you've been having for years.
Hmm. Yeah. So that's a good start. So we just stop, ask ourselves, like, okay, am I really hungry? So then obviously we've got a flow chart here. Like if the answer is yes, then we eat. If the answer is no, then what if you still feel that urge or that pull towards the kitchen?
Right. So we talk about, the first thing is your environment. So you need to kind of do an environmental scan. The quote unquote, we live in this kind of weight enabling environment where we make things very easy to consume food and sometimes not high quality food. So if you determine you're not hungry, what I often tell patients to do is, or if you're not sure, just drink a glass of water. Sometimes it's just dehydration that's making you actually
Hmm.
feel like you're hungry. And sometimes just having that feeling of consuming something makes that feeling go away. The other thing I sometimes suggest is a lot of it's distraction to kind of changing the direction that your mind is in. So one of the other techniques you can use is, you can just go for a walk. We also promote meditation. So you can do like, you don't have
Hmm.
to sit down for 20 minutes in a quiet room and do meditation, but you can kind of introduce deep breathing, sitting down for 30 seconds, really try to understand what's driving you at this moment in time that where you're starting to think about something stressful at work. And then all of a sudden that's been what your go-to is when you start having that stress, maybe go for a snack, trying to really kind of be present and understand what's driving you.
And let's go back to that social situation example. So you walk in, you're like pretty nervous, not really a time you can go for a walk, not really a time you can meditate. What would you suggest in those kind of trickier situations or, at work where you maybe don't have that freedom to do those kinds of things?
Yeah, so I think that goes back to social settings or social events. Often patients will be on these calorie restricted diets, for example. They may be taking a meal replacement product or, whatever it may be. And then all of a sudden now they have to go to a wedding or a birthday party. And I have seen over the years that can sometimes really throw someone off the progress they're making because you've been very disciplined, you've been avoiding certain trigger foods, and now all of a sudden you're in this social situation. So I think when you know you're going to go into those environments, you actually need to think about it before you go. So let's say I'm going to a wedding. Okay. So the first thing is you need to realize it's not going to be one of these perfect food days. You have to accept that. You got to first tell yourself, I'm going to try my best. You have to accept that you may actually eat more than you're expecting just because of the social setting and the environment. And that's okay. Like I always say, we're not aiming for perfection. We're aiming for more good days than bad days. So you got to be
Sure.
kind of kind to yourself, reasonable. The next thing is you got to kind of think of what your strategy. Okay, if I am going to, if I'm on a meal replacement program or something, and now I'm going to have to, quote unquote, eat regular food, what's my strategy? So what I usually tell patients is think about what you're actually going to eat ahead of time. So if you visualize and think about it, you're more likely to do it than when the time comes. You're not going to have that pressure to make a decision because you've already thought it through. So you might say, I'm not going to eat the breads with the appetizer. I'm going to just have a salad and maybe a lean piece of chicken if it's available. I'm not going to consume liquid calories, or if I do, I'm going to only have half a glass of wine. I'm not going to, so you have to kind of understand those. And sometimes what I tell people too is if you really are feeling stressed out, overwhelmed, go to the washroom, give yourself a break, 30 seconds, a couple of minutes, kind of collect your thoughts. And also, sometimes it's not unreasonable. Like you have to do what's good for you. If you have to leave a little bit early, that's fine too. Don't be rude, but sometimes you don't need to stay till 1 in the morning. Maybe you leave at 10.
Mhm,
You
mhm,
you, you
mhm.
came or you enjoyed yourself. You met your friends and family. Maybe that's it for you. So you kind of have to have an approach. Because social settings can really, it puts a lot of pressure on you. Sometimes also you think everyone's watching what you're doing, and then you're like, oh,
Yeah.
maybe, my aunt's thinking I'm not eating or something's wrong. And the reality is people aren't. People are consumed with themselves. And, I try to tell that to people too. Uh, People are more interested in their own lives. They have their own things they're worried about. They're actually not paying that much attention to what you're doing. So don't let that
Hmm.
be, a self-created stressor.
Yeah. Yeah, definitely. I love that. That sounds like exactly like a worksheet I teach, which is decisions ahead of time. There's so many decisions that you can make ahead that have even when you don't know the menu. Just like you said, you can decide ahead if you're going to eat the appetizer or not. Regardless of what the appetizer is, you can just decide if you're going to. And are you going to have the wedding cake or not?
Yes.
And making not only a food plan but a drink plan as well in those social situations is also super critical, because once we start in with the alcohol, sometimes the food plan can go by the wayside if we don't follow the alcohol plan. So it's kind of
Yes.
making those
They're kind of
all of those
interconnected.
decisions.
Yeah.
Totally, yeah, it's just making those decisions ahead. It can just go a really, really long way. And like you said, other people are often, thinking more about themselves. And I find that this is also a great decision to make ahead is, who do I want to connect with? Especially when you're talking about a wedding, a birthday party. These are people that and if it's a work function, maybe you want to network with a particular person. Like, think about not just the food, but the people. Because after all, that's why we go to these things. And so if we can shift our focus, like make some food decisions ahead and then let that go and think, who have I not seen in a while? Who do I really want to talk to? Whose kids do I want to ask about? And think about those kinds of things. People do love to be asked, right?
Yes.
And if you're overly focused on your body and your food, you're not going to remember to ask about that person's child that maybe just started college, right? Like, there's interesting things to talk about that are so much more interesting than your weight, right?
Correct.
It's so the least interesting thing about you, and very few people are going to notice what you're eating, if at all.
Correct. And I think those are a lot of the ideas we have in our head are often self-imposed. They're actually not
Mm,
based in reality. They're just things that we've thought up in ourselves and fears we create in our own heads, but in reality they're not there. And I think realizing that, and sometimes, one important thing I think also is to kind of do the post-mortem after a social event, see what
hmm.
actually happened. If you had some like, anxieties or stressors, and then you realize they actually didn't materialize, that sometimes is very informative too. Is like you kind of realize, I had these, fears, and people were happy to see me. Nobody was really concerned with what I was doing. It's empowering when you realize that after.
Yeah, for sure. So I know you use some affirmations as well. Can you give us some examples of those that you think are helpful for your clients in different situations?
Yeah, so affirmations are important because I think a lot of times we have negative self-talk that's going on in our head, and a lot of times, patients have tried different weight loss programs, and they haven't had the success they were looking for, or didn't have the lasting results they were looking for, and then they start thinking, well, this is going to be like every other time. I'm not going to get the results. So then when you think about doing something new, those thoughts start kind of making you not look at the new approach in a more positive way. I think that's where
Hmm.
affirmations come in, because over time, affirmations kind of can cloud out or push out those negative thoughts, and then you adopt more of a positive mindset. So affirmations they should be personal to you. They should be also present. So those are what I kind of ask people when they develop their affirmations. You should pick some that are good. So um, like one, for example, would be, and I don't tie affirmations to like a specific goal, like I'm going to lose 88 pounds. It's more like
Hmm.
I'm going to make healthy food choices today. I'm
Hmm.
going to be a healthy person. So you kind of just promote sort of what you want to be and not a specific number or a goal. It's to create
More like an
more.
identity.
That's right. And an
Hmm.
approach to, almost an approach to life, and that ties to your personal beliefs and values.
Perfect. I love that. Thank you. And along with that, you think journaling is also a helpful tool?
I think journaling is very important because in a way it's a form of reflection.
Mm.
I think it's something that if you do daily, it lets you why I think journaling is important. I do it for my own personal life for a number of different reasons. So ultimately, the thing that determines our life is our choices, and our mindset is ultimately what guides our choices. So if you want to change your life, you have to change your choices, and in order to change your choices, you need to understand why you're making your choices. And journaling to me is a forced way of kind of really being critical of why you're doing what you're doing. So, for example, like if you, let's say that we're talking about the context of losing weight, let's say you've had a few bad days of not, no suboptimal food choices. If you start to write down and try to understand why did I not do this today? Why did I do this? And then you start to realize, oh, it's because, I had an argument with, somebody at work, or I grounded my child and they got mad at me. And then you start to understand, okay, these emotional triggers are what is making me make these choices. You can then reflect on that. And also, I also find like that act of physically writing, it imprints deeper into you because you're kind of, you're doing that physical action. So I used to find when I was a student, if I wrote things down, I felt like I
Mhm.
understood them and they stayed with me longer. So that's why I think journaling also is very helpful.
Yeah. I like thinking about getting my thoughts out of my brain too, because sometimes they just are swirling or swirling, and you're just like, I just need to see them on paper, and just kind of downloading. I sometimes call it a thought download onto paper can be so helpful to just see what I'm thinking in black and white.
And to decompress. And it kind of also, you can
Mm,
look back over time. It's kind of a written record. You can see how you've grown
mm,
when you look at
yeah.
maybe your entries from 3 or 4 months ago and where they are now. It's almost like a written record of all the hard work you've done and also how you've changed or grown as a person.
Yeah. So shifting gears a little bit, there is a term called the obesogenic environment that we live in. What does that mean? Why do some people survive in this environment and stay a natural weight, and some people don't? Like, what is that, and how do we manage that in our effort to manage our weight?
Yeah, that's a really good question. Yeah, so I think modern society has, there are lots of benefits to all of our technologies and ways we do things, but obviously there have been with positives always some negatives. I feel like what the obesogenic environment means is that we're living in, wherever we live, um, there are lots of things that promote us to increase our calorie intake, but also to decrease our calorie expenditure. So, for
Mm,
example, food delivery apps, to me, it's a weight gain enabler, something that enables you to gain weight. So in the past, if you didn't have time to cook something at home, you'd have to actually drive to the pizza store, walk to the pizza store, get a pizza, wait for it. That in and of itself would sometimes be, you know, enough for someone not to order it because it's
mhm,
winter time, it's snow, oh, I gotta clean my car, put my boots on, go. And but then at the same time, you were being much more active. You had to actually be physically active to go and do that. Now with just a few clicks, you can have anything you want at any time. So
mhm,
it's really made access to food has just really become, and some really fast food has become much more accessible. And then also, when I talk about the obesogenic environment, there's like the general, society, the processed foods. The many people where they live, they don't have access to nutritious food. They're more likely to get a fast food rather than
mhm,
fresh fruit. So some people's environments just are such. But then, so you got to look at the macro environment, then also look at the micro environment, your specific setting. So at your work desk, do you have treats, readily available? A lot of people keep treats when they're typing, then they take a snack. They're thinking to take a snack. So again, you're making it easy to have access to unhealthy food. And also it makes it easy to kind of snack unconsciously, like we talked about earlier. And then even your own home. So I always say, like, take stock of, when you're trying to make changes in your house, like take in your home, take stock of what are the things in your home that may be promoting you to make unhealthy food choices. That's again being mindful, being aware. Like, are we leaving, bags
mhm.
of chips on the counter so I can grab it right away? Or do we have all these snacks that, rather than having like pre-cut fruits as a snack, Are we just getting little packets of cookies and things like that? So I think that that's kind of, when you're talking about the obesogenic environment, there's the broader
Mhm.
society factors, which you need to be aware of so you understand that they're happening and you can kind of make strategies to deal with them. But then there are also things you control. So your work environment, your home
Yeah.
environment, those sorts of things.
Yeah, there's a lot of like society things that are a little more almost government, public health kind of thing that we can vote on. And then there are the things that we can do right in our home, regardless of what is going on in our local or extended communities. So yeah, tons to practice in our homes. And then once we practice in our home environment, setting that up, then we're more likely to be successful in the greater outside world environment. Yeah. Especially
That's right.
too, like if you set up your home as an environment where there is healthy food available, or you've even just learning to cook a few recipes, maybe that's, a stretch for you if you don't know how to cook healthy food, starting to watch YouTube videos, learn how to chop vegetables, like, start there, then you're less likely to get out into that fast food world if you have things that are ready to go faster at home. I like to encourage my clients to buy those sort of convenience foods that make your life easier, like rotisserie chicken. Pre-cooked proteins is like a convenience food that I think is so worth it because it just helps you stay on track. Bagged salads, all those kinds of things that are that kind of minimally processed, but totally help you. They end up really being like whole foods as opposed to the ultra processed foods.
That's right. And I think that's sort of, it kind of ties into like the obesogenic environment is that, there's been kind of a loss of a separation between the work life and the home life. People
Mm.
now are bringing their work home. They have so much time demands. And then often what happens is, you don't have the time to actually
Mhm.
prepare your own food, whole food, nutritious food. And I think and one of the things I tell patients or I encourage people is that you should kind of use like Sunday evening as your meal prep day.
Mm.
So, make 3 or 4 lunches, or say I'm just gonna have the leftover dinner for my lunches.
Mhm.
So you kinda do all the meal prep where you might make 3 or 4 meals, and you have them Monday, Tuesday, Wednesday, Thursday, and then you kind of dedicate 2 or 3 hours to do it, and you may have to eat the same thing 1 or 2 times a week, and that's okay. But that's kind of those speaks to the strategy. You have to kinda look at your specific lifestyle and try to come up with solutions that work for you because everyone has, we are all busy. We got,
Mhm.
work requirements, family requirements. It is becoming very challenging because everyone's so busy.
Yeah, for sure. Okay, I was wondering, this isn't something we had talked about ahead, but I was wondering if you could address just a little bit about who would be candidates for some of the things that you offer. Because I think that sometimes, people don't realize like what the options are for weight loss. They just are like, well, I just have to eat less and move more. And while that is, from a thermodynamic standpoint, essentially true, there are ways to help us in that. And so who would you say would be a good candidate for surgery, and who would be a good candidate for medication help, and who would be someone who should not choose any of that? And I'm going to lead you a little bit here
Sure.
because what I've been noticing lately is this idea that people that are using assistance for weight loss are somehow ignoring eating healthy and moving their bodies and exercising, like that it's one or the other. You can either take medication or you can eat healthy and exercise. And I just find that to be so untrue, that the person that is taking the medication is doing that in order to eat healthy and move more. And so I had said on a podcast a couple weeks ago, like, you're not a candidate for medication if you don't actually want to eat better and change your diet. Like, if you're a person who's like, I just want to eat cookies 3 meals a day, like, medication is not going to solve for you. You don't actually want to. Does that make sense? And it's not to judge. Like, if you don't want to change your body, by all means, don't. Don't. But if you do, who would be candidates for like each of those categories? Does that make sense?
Yeah, that makes sense. So I think the first thing is when we talk about, let's say, surgery or pharmacotherapy, which is, like GLP-1
Sure.
agonist medications like Wegovy or Ozempic, those are tools to assist the patient to lose weight, but they are not the solution in and of themselves. So, when we talk about weight loss, the energy in, energy out is very simplistic and it doesn't explain, you can have two people who are identical and they can eat the same amount of calories and do similar physical exercise. And one of the patients may, not gain any weight and the other one may gain weight. And there's lots of factors for that. It can be your genetics, your set point, your microbiome, which is the bacteria that exist within your colon, which can change how efficiently you utilize calories. So sometimes it's things that it's just your unique biology and nature that despite, actually living healthy, you are still struggling with your weight. So there are patients who, have tried various weight loss regimens, have not had success, are still struggling with their weight. So when we talk about surgery, the first thing when I see a patient is I do want to see a commitment to actually engage in behavior change and lifestyle modification. Because it doesn't matter, like if you do a gastric sleeve, it doesn't matter, how tight you make the sleeve, you can still gain weight if you don't have healthy eating practices, and you can blenderize your food, you can drink your calories. If
Mm-hmm.
you drink your calories, you're never going to feel full, but you can gain a lot of weight.
Mm-hmm.
So that's really part and parcel to having a successful surgery. Is this one, you got to do a technically sound surgery, make sure that it's done safely, but you have to couple it with lifestyle modification and behavior change. And that's where I think, like we talked about, the mindfulness, counseling, introducing physical activity in your life are very critical. So, they talk about like the body mass index when we talk about surgery, which is a
Mm-hmm.
measure of your weight over height, very simplistic, but we do have guidelines that kind of direct us towards which patients may or may not be a good candidate for surgery. Then you have to combine that with, are they ready to make a change? Um, because the surgery can only take you so far.
Mm-hmm.
Then if you want to have that sustained weight loss, that's where you have to really make that commitment that this is going to get me over that plateau or hump that I haven't been able to get past.
Mm-hmm.
The surgery is going to be that tool to get me there. But then I have to, while I have the aid of that tool, I need to invest in changing my mindset and the things I do day
Mm-hmm.
in, day out. And I think the same thing applies with, the pharmacotherapy or GLP-1 medications. For sure, when you take them initially, you probably are going to have some weight loss and as it escalates. But as we've seen, when patients stop them, a lot of patients can regain the weight.
Mm-hmm.
So, when you are on those medications, take advantage of that tool that's helping you kind of lose weight or even maintain your weight and do the deep work that you need to do to kind of change your behavior and your mindset. So one, even if you stay on the medications long term, perfect, you're still changing your behavior. But if for whatever reason you have to get off it for side effects, tolerance, cost, whatever it may
Mm-hmm.
be, you have developed that tool set or that skill set to kind of help you continue on your weight loss.
Yeah. And I'm so hopeful that the cost will go down eventually for those people that do need it long term. And, if it's still benefiting you, I just don't see why and obviously I'm not a doctor, but from what I've read, it doesn't seem like it's a bad thing for those that need it long term or that it's helpful for them to maintain that. I've seen people that have just gone down to very, very low doses for maintenance. Is that kind of what you're seeing as in
Yeah,
your
I mean,
practice?
there are people who are doing microdosing. You typically, like with Ozempic, for example, there's a schedule where you slowly escalate it, and you have to balance how they're responding to it,
Mm-hmm.
and then you have to balance it against side effects. Sometimes when the side effects, not everyone gets them, but some people do, nausea, GI upset, those sorts of things, you may have to titrate it down. And we have had patients also who've been on it, they had to stop it, then they kind of get on it later. So it's not that you necessarily have to be on it continuously.
Mm-hmm.
There may be periods of time when you go off it and then you might go back on it again.
But like specifically for maintenance, do you titrate back down? So say you've titrated all the way up and you lost your weight, and now you're like, okay, I just want to maintain. Do you then titrate down and then just stay on like a extra low dose for maintenance? Is that a thing?
You can do that for
Yeah.
sure. And
Okay.
often a lot of times if patients get to a steady weight, they may just stay on that dose if they're not
Mm,
having side effects.
okay.
But some patients, they may want to go on a lower dose or based on side effects, try to lower it and see if they respond to it.
Okay. So lots of options working with your practitioner is the
And every patient's
recommendation.
different.
Sure.
Like, yeah, you have to kind of individualize it to their specific circumstances.
Yeah. And would there be a person that you would say, you know what, you're not a candidate for any of this? What would that person look like?
So, for example, if we're talking about surgery,
Hmm.
there are certain patients we would not offer surgery to. There are obviously like the technical situations where they've had lots of abdominal surgery and it may not be safe to do the
Hmm.
surgery, lots of scar tissue. If they have contraindications of doing the surgery safely, such as severe heart disease, those sorts of things. So those are the sort of the medical end of things. But if we're talking more about the non-medical aspect, I think if someone is struggling with addiction, that's not someone we would, substance abuse, we would not offer surgery. They need to deal with
Hmm.
that first before doing this. If they're not committed to behavior change, so that's where the preoperative, assessment and really understanding, are they going to participate in this? Because if they're not going to succeed.
Yeah. I would say the commitment to behavior change is probably for both for surgery as well as for medication. You have to be willing, you have to be ready to commit to that behavior change.
I agree with you.
Yeah.
Yeah. Again, it's a tool. It's not, it's a tool to help you, but it has to be
Hmm.
coupled with behavior change, lifestyle modification, all of those things.
Yeah. Perfect. Okay, this has been so great. Thank you so much. Again, where can people find you online if they want to learn more about your practice?
That's right. So you can go to my website is www.peelweightlossclinic.com. Um, we have lots of, we have blogs and they also give information about the different programs we offer. Also, you can visit my Instagram at Peel Weight Loss, at Peel Weight Loss Clinic. It has lots of, I put up regular posts just to kind of give patients tips and tricks and information as needed. And also I have my instructive journal that I made. It's available on Amazon. I created this just because a lot of patients can't, it's not accessible to do counseling or cognitive behavioral therapy. Those things may
Hmm.
not be available to everyone. So this is more of a self-directed instructive journal, just to kind of use some of the techniques that you and I discussed now in kind of a structured way.
Nice.
So patients will kind of, the first part of the book is information about, affirmations, manifestation, journaling, meditation, those sorts of things. And then the second part is just pages where you can actually do the journaling activities. And then I put inspirational quotes for every day just to kind of give you something to motivate you to kind of tackle the challenges we all face every day.
Perfect. I love it. We'll put all those links in the show notes. Thanks again.
Yeah, it was a pleasure. Thanks for inviting me.
If you want more support with your weight loss, especially if you're navigating appetite changes and side effects with GLP-1 medications, I'd love to help you inside my coaching programs. Start with my GLP-1 Success Starter Kit if you are even considering medications or if you are already taking them but feeling kind of lost. Because GLP-1s are a great tool to assist you with your weight loss, I've developed an entire program that is specifically for people who are on these medications, so be sure to check that out. You can always book a free consult call through the link in my show notes to make sure we are a perfect fit. And I do still have programs that are for those that are not using medications as well, or would be appropriate for someone who has participated in a surgery like Dr. Kundhal performs. I will talk to you next week, and remember, it's not just about the food, it's about empowering yourself with choices that truly serve you. Have a great week, and as always, thanks for listening to the Eat Well, Think Well, Live Well podcast.